Absolutely never. So a lot of times they do ask me for things that I don't believe will do good to their face at all, and I strictly say no. And if I say no once, it is a no. Because to me, I have a really good analytical eye, and I have a good aesthetic eye, and I know what looks good on whose face, and technically also we know what looks good on whose face. So there are very rarely, if someone asks me, have I said no once, then I go home and think a lot, and then if I think yes, that will do good to their face, I do call them back, and we then discuss again and we work it. But there are times when I know this is absolutely not good, then there's no way I give in to their requesting. That I don't do. That I never do. So what they do sometimes is, some of them, they just don't seem to understand. They go to another doctor, they try and get it done. Invariably that does not do well, and then they come back, and then we end up correcting it. So we won't do anything which is drastically harmful for them at all. There are certain medications which could harm them. We don't use any of that. I always use the time tested, the best policies for me. I know exactly what we are doing, and I do the all guns. We start off with proper home care, literally things like proper hair care, like shampoos and what is it that you need to use. Up your certain levels like probably iron, proteins. So we sit and look at all the blood parameters to see that the nutrition is up at the right level. Then we look at the hormone parameters to see if their thyroid is right, if their DHT is right, and we look at all of those to see whether that's contributing to hair fall. We correct that if there is. Then in the end, we also end up doing office procedures.